No buts about it. It's time to get started with our very first question.
Hi, doctors. I have a question, and it's an embarrassing one. I have a maddening itch in the most frustrating place, my anus. I've tried washing with different soaps, wiping with the most luxurious toilet paper, but nothing seems to help. It feels like my anus is on fire. I'd like to know, what could be causing my itchy anus? And is there anything I can do about it?
Proctologist and colorectal surgeon Dr. David Rosenfeld is here to help us out to deal with a really itchy problem. When things start to itch back there, it gets worse and worse.
It's a nightmare.
You don't know what to do.
Right. It's a common problem. I mean, it probably affects 40% of the people in the audience, 40% of the people at home, and it is embarrassing. You know, I might come up to you and say, oh my God, did you see a basketball game, or, you know, or talk to you about anything. Hey, where'd you get your clothes? But I don't come up to you and say, man, my was itching so bad. And I went to see my proctologist, and he helped me, and it's great. My butt doesn't itch anymore. I mean, people don't talk about that. So they go online and they get uneducated. And I think it's time we get anal about anal itching. And I don't mean anal, I mean educated.
Let's
let's
do it.
educate people about anal itching. First of all, anal itching, it's euphoric when you scratch. It triggers the pleasure center in the brain like any addiction. So even if I get rid of it, in a while, it will come back. The brain brings it back. So just that patient understanding is huge. And then the second thing is it's multifactorial. It's not like one thing, one problem, I can fix it. There's not one pill, not one potion. It's a lot of different stuff that we're going to talk about. But the number one thing, bowel stool consistency. The stool has to be consistently solid and come out, and I think we have some...
So this is this...
So this, yeah, sausage and toothpaste. So this is what most people have, toothpaste coming out of the anal skin, okay? And when it comes out and you wipe...
So that's what you're calling sticky poo?
Yeah, and it sits on your skin, and you wipe. What's left in the anus? What's left in this toothpaste tube? Toothpaste. It's going to come out later, and about 2 hours later, you're going to have sticky stool on the skin, and you're going to go wipe again, and you're going to say, oh, I have more stool there. And you keep wiping.
You keep wiping and wiping, and it keeps coming and coming, and,
right.
You know, that's...
and that's bad.
It is bad, and
right.
It's irritating, and it's uncomfortable, and you don't want to talk about it to anyone, but
right.
it happens.
And
never to me, but I've heard.
Right. I mean, this is the problem. And so with the change in diet and doing the right things, you want it to come out more in one piece, like this sausage. So when stool comes out, it needs to come out in one piece, slides out, smooth, plops in the bowl. You wipe once, and there's nothing on you anymore.
Well,
and then you don't wipe
often,
again and again and again. You're clean.
Add fiber.
Right.
Add fluids.
Water.
Because
yep.
Interestingly, the fluid and fiber combination will make it less sticky, harder. And then let's just say theoretically, though, no matter what you do, you're a little more on the sticky side.
Right.
Let's start talking about ways to avoid the irritation.
I mean, as far as even wiping itself, if this is, especially, I mean, for women, for men, it really doesn't matter much, but we'll just put a little bit of food coloring on the anus and near the anus up here.
So
and
that's
the vagina,
anus?
yeah, that's kind of the anus. The vagina's down here. For women, you want to wipe from front. There's the vagina, back this way, so that you get the stool to come back toward the anus. You don't want to wipe forward from the anus to the vagina. You want to put stool from the anus to the vagina, and especially if it's sticky. This is the crack, and the anus is here. The vagina is up here. So you wipe front to back.
Front to back. What is this tip to avoid anal itching?
I would avoid toilet paper completely.
Really?
This is the biggest nightmare. Toilet paper is paper, it's wood pulp. Most people are allergic, they don't even know.
Right, but if it's sticky and it's all over, you need to wipe with something.
Right, I would use unscented, alcohol-free baby wipes. Now again, try to get the stool not to be sticky, because when it plops out like that and you do this, it'll look exactly like this. It'll be clean, there's no brown, there's no nothing.
I'm going to ask you a really personal question.
Yes.
Are you a no wiper, a one wiper, or a two wiper?
I'm a no wiper.
Really?
90% of the time. If anything, 2 wipes out, and that's fiber. It's a psyllium, that's fiber. And when I don't, I'll think about it. I go, you know what? I didn't take my fiber today. And if food fiber is one thing, but a psyllium husk-based fiber, and there are some really good ones out there. You take it every day, in 4 or 5 days, it plops in the bowl.
You also have good genetics. Done. So what you're saying though is, if you're a non-no wiper, if you're not as lucky as you are, you're going to use these because it's a little less irritating.
Right.
And for folks watching at home, we're having a little bit of fun with anal itching because most of the time it's just irritation of the anal area. If you're having acute onset of new anal itching, you do have to think about things like hemorrhoids,
right.
tears, in some rare cases, cancer.
Yeah.
So if you have new onset of itching and pain, you probably do want to get your area looked at. It's hard. It's hard to say, you know what, it's time to go see the proctologist.
Right.
But without someone else looking back there and figuring out what the acute causes of this new itching that had never been there before, you may not know. You may not know that you have a tear or
a fissure, and hemorrhoids do play a role. I mean, look what we have so far. I mean, we've got the stool consistency, what you're wiping with, soap. So people are anal about their anus, and this is the thing that drives me nuts because they come in. I'm like, do you wash with soap? Oh yeah, a loofah, soap. I got 10 different types of soap that soap is so bad for the anus. I mean, the mouth has more vile bacteria than the anus, and if our anus had taste buds, we wouldn't be washing with soap because we don't wash our mouth out with soap unless you say the wrong thing. I remember that when I was a kid. But yeah, we don't brush our teeth with soap. We use toothpaste, and we don't want toothpaste down the anus either. But soap is bad. It defects the skin. It irritates. It's so bad. Washcloth and water.
Why do we have cola, chocolate, and coffee out here?
So the #1 food-related association with itching is caffeine. Good studies show that the people that drink and eat more caffeine have the most amount of itching. So my patients look at me and go, are you kidding me? I have to stop coffee. I can't drink coffee anymore. I say, no, don't cut. Just cut back. Every couple weeks, cut back a cup of coffee. And most people say I have a cup of coffee. Now, this is probably about 6 ounces. That's about a cup. I mean, most people are going to the coffee shops, and they're getting like the big gulp coffee. They're, I only drink a cup. I'm like, no, you're drinking 12 cups of coffee. It's just one big cup. So, maybe go to a half, because that's like 10 cups of coffee. But if you're a 2 to 3 cup of coffee drinker, I'll say, yeah, go to 2 to 1. Every day, try to cut back.
Are my 16 ounces?
Yeah, it's not good for itching. If you're not itching,
you know what?
It's not a problem.
I'm willing to take the trade-off. But this is really the takeaway. This is what you can do to keep things nice and solid, coming out regularly.
Yep. Fiber, beans, lots of fiber in beans. The shell of the bean, but beans, good for your heart. The more you eat, the more you fart. The shell of the bean is fiber, and fiber gets digested by our colon and the bacteria, and it produces gas. So there's always a yin-yang. So you eat more fiber, you may have a little bit more gas. So that's something to beware about. But it's important if you want to stop the itching and have better bowel movements. And obviously
it's
broccoli,
not just
spinach
better
is
bowel
huge.
movements. Fiber is better for a lot of things. Can reduce your cholesterol, can improve your overall health. So I really think we have a fiber deficit in this country. The average American eats 11 grams of fiber. Women should have twice that, men 3 times that. So this is the one place where I would also say, and you admit the same thing, is get more fiber in your diet. Eat the whole grains. But if you need a supplement, that's one area where you could try to supplement with fiber. A fiber supplement. See if your stools don't get a little more, I don't know what the word is you use, but smoother, more consistent,
solid,
fewer wipes. Give it a whirl.